right, we're getting a 22-year-old female on a versus pedestrian, 20 miles an hour.
I like to think of the trauma team as a pit crew for humans.
Take a big breath.
When a severely injured patient comes in, it's our job to find out what's wrong and then fix it fast.
Now on 3.
3, 2, 1, let's go back down.
I've been a trauma nurse at Palomar for 30 years now, and I consider it to be the most rewarding subspecialty in nursing because it's a real privilege to be able to intervene on critical patients on the worst day of their life.
Well, about 10 years ago, I was a trauma patient here at the hospital. I was on my way to a morning shift, and I was taken out by a car on the freeway on my motorcycle. I was knocked unconscious, broke a lot of ribs, damaged some kidneys, and had a small collapsed lung. And I was brought here to Palomar as a trauma patient. Dr. Steele and Honda are on staff right now.
Is this her? Is this her? Is this her?
You've got a golden hour is what it's called. You have an hour. Most patients that make it to us will survive, or at least will be able to be stabilized for some period of time. And the goal is to find the bleeding, stop it, find the soilage, stop it.
Dr. Steele commands the trauma room. When you walk into the trauma room, you realize that Dr. Steele is going to be your surgeon, or I'm turning over my patient to Dr. Steele. I know what he wants, I know what he needs. He does the same for us. The respect and the professionalism is unbelievable. When Honda's in the trauma room, there's a sense of patient's going to be okay. Trauma is not just about taking care of the patient, but it also comes from the heart.
We're giving you some pain medicine, okay? You're gonna be all right.
I would say the difficult part of working in the trauma room for me is when you see patients who've suffered injuries through no fault of their own. You know, no one wakes up in the morning, brush their teeth, and expect that they'll be fighting for their life in an hour.
How are you doing, hon?
Any hospital with money can buy great equipment, but you can't buy the level of excellence that people strive for here. You can't buy the caring and compassion that the people here have. People take it personally. Patient care is personal, and that's what makes Palomar different.